Hi, I'm here with my client Pat. Want to say hi, Pat?
Hi.
Hi. And we're going to do some work inside her mouth, what's called intraoral work. I've done this work with hundreds of clients. It's so powerfully effective for lots of different things, both for working on people locally who have, TMJ syndrome. A lot of people have asymmetries and some dysfunction in their jaw. People who've gotten dental work sometimes are really left kind of, constrained and challenged in this area. But a bigger part of is that people don't know about is that anytime there's any challenge in the neck function, all these neck muscles lead up here into the jaw. You can see all of this back here. So I use vinyl gloves, and I'm simultaneously, as I'm doing that, working on the facial muscles with one hand in the inside of the mouth with the other hand. I may use both hands to work the facial muscles, and then I'm working the structure of the jaw itself. So take a look. I never know exactly what I'm going to find inside, and I'm modifying the treatment according to what I find and according to how the client responds. So here we go with Pat. What's going on with Pat is that I was at the end of the session and her head was rolling to the left. I asked her what was going on. She said, well, there's something in the right that's catching a little bit. And so it just feels like it relieves it to roll my head to the left. And we said, well, that's a good time to go inside. So that's what we're going to do. Thank you, Pat. Let me film this. Glove, the snapping of the glove is a critical part of the process.
They're not really on until they've been snapped.
Exactly. And I've got this wonderful, what do we call it, grease-free facial stuff that most of my clients really like. Let's see. And open and rest. And I'm coming. Okay. And it's hard to see everything I'm doing with my fingers are just below her eye orbit. And I'm smoothing out. Good. I'm going to pull the camera around and see if I could do this from a different angle, because I can't really see what I'm doing. Here we go, and open again, and rest. Here we go. Right, so this is very specific muscle here. I'm reaching in with my middle finger on the inside. There we go. I'm just holding the pressure constant, and I'm just tracking her breath. There we go, nice exhale. So then I move my contact around. I put in another hand. Well, I'm feeling this. It's where your mandible comes up against the, I think that's the temporal bone there. So I'm going to get a little tissue. And I actually want to lift the skin from the outside. Oh yeah, that's really something, Pat. And then I lift the whole sternocleidomastoid off the neck. That's it. Holy smokes. She's giving me the thumbs up. All right, I'm getting more cream. right, open again and rest. Yeah, that's gnarly. There we go. Okay, and let your jaw go a little wider, and then soften, and then pivot your lower jaw to the right. That's good, and then the left, and the right and the left. So I got my finger in there, and she's moving her back and forth around that's my middle finger. I'm right around the wisdom teeth between the lower gums, and I don't know what you would call that. Bottom of the mandible. There we go, and I'm pulling all of that up. Fantastic. Ooh. Good. Wow. All right. So we always want to go in the other side because that's such strong work to do. We want to, it's an important part of it. Go to the other side. I've never had a client in all my years doing this ever report that something I did threw something off that created a problem. Once someone was a little sore the next day, once or twice. But nobody ever had any. That hasn't always been true with lower back pain. Like that.
I found this to be really effective. It makes me realize that trying to get the muscles of the neck and the jaw to release without getting from both sides is like working with one hand tied behind your back.
Yeah, the other interesting thing, I might have told you this story, Pat, I had the client who was a choreographer who came in with the lower back asymmetry that got relieved just by working her jaw.
No, I didn't.
Yeah,
know
she had
that.
some serious jaw dysfunction for whom she was seeing some kind of dental, I don't know, some kind of dental specialist. So she had a jaw history, but her whole right sacroiliac thing cleared out from doing the jaw work. So the jaw is such a profound mirror of the pelvis. It's just crazy. All right, open and close. Oh, hello. Okay, so we're going to roll ahead to this side. Oh, so she's got some tenderness there. I'm starting it the same way I did in the other side. I don't know what you'd call these muscles, but between, like underneath that's not even a cheek, to the side of the nose below the eye. They're like smiling muscles. There we go. Is that okay?
Yeah.
You know, Pat and I have worked together for a long time. So I know what her pain tolerance is. With another client, I'd be going a lot more slow. There we go. Beautiful. I'm going to come back in again. I like to give people little breaks. And open And now I'm going to do something a little different. I'm actually going to relevering the whole skull and pulling away. This is on the other side where the facial muscles attached to the lower jaw. That was more significant on the other side, right? This is just gliding here, which reflects what was going on in that shoulder. Yeah, good. There's not that much to do here, as I thought. And then we always come back and we finish up. Wow, you got so much more room there now than here. Let's just do another sweep up here then. Okay. I got you. There, and we go back and forth, cranial base, suboccipitals. Now one thing I wanted just, since you're here, you didn't need this exactly, but since we're doing a little video for the viewing audience, if that's okay with you,
Yep.
I want to show what it'd be like to actually go into the jaw, the TMJ joint. Might as well do it on the right side since that was the trickier side. All right, so open and close. And so what I do is I'm going to the jaw itself. It's obviously behind where the facial muscles are. And again, I'm not so great with muscle names. Pterygoid, I'm embarrassing myself. But I reach in here, and it's like a little cup. And I get my finger in the cup, and I invite the client to actually make some little adjustments with the jaw to let my finger in. And in her case, there's not a lot of charge, but in some case I can feel a lot of inflammation, a lot of restriction, and I can really finely adjust my contact to match the client's contact to work right at this threshold to allow it to just soften and open up at a level they can tolerate. And she's doing that really beautifully. If you've been watching her, you can see she keeps changing the position of her jaw to accommodate my hand here. And this is the thing that I really want to go for a lot of people, is to get some room between the jaw. A lot of people's jaws, they're recessed far behind. So what I might say is, so bring your jaw so that your lower teeth are in front of your upper teeth. That's it. And then come back and forth. That's right, back and forth, and that's beautiful. And then hang out in the forward position, and then I pull everything forward in the musculature. That's fantastic. And then from there, I want you to like yawn and rest. Good, beautiful. So that's a great example. She didn't really need it that much. But how's that feel after I did that? It took you to another level?
Oh yeah,
Oh.
it still feels good.
Right. Excellent.